Hi, everybody. Thank you so much for coming to tonight's event on abortion access during the pandemic and beyond. We're really glad that you're all here, and I would love to thank all of our co-sponsors for this event tonight. PM Press, National Women's Liberation, Shout Your Abortion, NYC DSA Socialist Feminists, and NYC for Abortion Rights. So this event features a conversation between Jenny Brown, Amelia Bonow, and Marie Solis. The speakers are going to be talking about how abortion access has been chipped away at for decades, even before this crisis started. During the pandemic, many conservative states have deemed abortion as non-essential health care, and they've tried to ban or severely restrict the procedure in many cases. So all of our speakers today are going to be talking about how this crisis is affecting abortion access and how we can learn from history to build a fighting movement for free and equal access to abortion care. So just want to let you all know that you can buy Jenny's and Amelia's books. If you click the link below where it says buy books from the panelists, it will take you to Bookshop. Bookshop is a great e-commerce platform that supports independent booksellers. 30% of all of the sales through Bookshop actually go to support independent booksellers. So I'd highly recommend buying through Bookshop or buying directly from Verso and from PM Press. Verso is currently having a sale right now with 50% off all of our books and 80% off all of our ebooks until May 24th. So you can buy Jenny's book and lots more books there. This event is being recorded. It's going to be archived on Verso's YouTube page. If you'd like to check that out later or share that with friends. And then just wanted to let you know how to ask questions to the speakers. So we're going to have maybe 45 minutes to an hour-long conversation, and then we're going to take some questions from the audience. So you can post your questions right here in the chat. You can pose them as a question, and then they'll move over to this Ask a Question feature. You can also go to Ask a Question to ask questions directly, and then you can vote on which questions you're most interested in the speakers responding to. So please do ask lots of questions, and we'll get to those at the end. So now I'll just very quickly introduce all of our speakers. Jenny Brown is the author of Without Apology, The Abortion Struggle Now. She was a leader in the fight to get the morning after pill over the counter in the US and a plaintiff in the winning lawsuit. While she was the editor at Labor Notes magazines, she offered How to Jumpstart Your Union, Lessons from the Chicago Teachers Strike. She writes, teaches, and organizes with the feminist group National Women's Liberation, and she's the author of Birth Strike, The Hidden Fight Over Women's Work, which is published by PM Press. Amelia Bonow is the founding director of Shout Your Abortion, a movement dedicated to broadening the existing cultural discourse around abortion. In 2015, Bonow's abortion disclosure inspired a viral outpouring of abortion stories on social media, receiving front page coverage from the New York Times, the LA Times, as well as the New Yorker, ABC's Nightlife, and the BBC, Al Jazeera, and CNN. And Marie Solis is a staff writer at Vice with a focus on abortion pills and reproductive health. She was previously a politics writer at Newsweek, and she's written for The Nation, Teen Vogue, Glamour, and The All. So those are our speakers. I'll also just say that a ton of other independent radical publishers are having lots of great deals on their books right now. We're all kind of struggling to survive during all of this. So if you want to go to the Left Book Club website, you can see all of the participating partners in this Left Book Club, and it kind of shows you how you can support them. So I'll put that link in the chat later too. So I just wanted to start off with a handful of questions to turn over to our speakers. I would love to start with a question looking at the past. So this is a question for Jenny about what today's organizers can learn from the repeal all abortion laws demands that were put forward by the women's liberation movement in the 1960s and the early 1970s. So what can today's activists learn from those demands in that movement?
Great, thanks, Anne, and thanks for organizing this. It's really wonderful to be here, even if virtually. When I wrote Without Apology, basically to try to condense the experience of the women's liberation movement, the radical branch of the women's liberation movement, into an accessible history that people could read now. And one of the things that you learn when you look at that history is that we had a whole abortion movement in the post-World War II period, trying to get reforms to the law, which in most states made all abortions illegal. And, you know, they were looking at palatable exceptions to the law, like, oh, well, the woman had already had 4 children. Could she have an abortion? Maybe in cases of rape, it should be allowed. If she was suicidal, perhaps. So this was the debate going on in 1968 when the women's liberation movement burst onto the scene. And they compared their experiences getting illegal abortions, realized that they had all been getting them and not telling anyone, and decided that it wasn't a personal issue, but a political one, which was actually kind of a surprise to a lot of people. And so they demanded repeal of all abortion laws and free abortion on demand. And in particular, in New York, by 1970, they had one significant reforms in the law, basically abortion on demand, although it wasn't free. But it's very clear when you look at this history that it was the clear demand for abortion on the basis of women's freedom and self-determination, and now we would say anybody who can get pregnant's freedom and self-determination, that gave us the laws that we have and got us the advances that we did get, even though they are partial. And we've been really going backward ever since the strategy became, oh, let's not sound wild and crazy. Let's be reasonable and professional in our approach. Let's emphasize privacy and health and go back to emphasizing cases of cancer or rape or being suicidal. All these things we've sort of returned to the reform strategy that preceded the demand for repeal of all laws. So the spirit of that is that we don't want our political strategy to be led by people who think that sounding reasonable while lobbying, having good relationships with public officials, which inevitably drops back to the extreme cases and the lowest common denominator. And I think this strategy comes from a misconception of how we won what we did. I mean, I have read many history books that say the Supreme Court gave abortion rights to women in the United States. And because they were into privacy or they, you know, were far thinking at that time. And what happens when we think that that's how we want it is then, well, everybody emphasizes privacy or, you know, how our legal strategy should look, rather than looking at the enormous movement that it took to get abortion legalized in the United States, and that's really what we need to continue to do and continue to fight on the basis of a liberation struggle, as opposed to kind of you know, an apologetic trying to work out a compromise where we can keep what little we have of abortion rights.
Great, thank you. I'd love to talk a little bit about how independent abortion clinics are faring right now. I mean, independent abortion clinics are always very vulnerable, but especially so right now. So I was hoping, Amelia, you could talk a bit about this, and then Marie and Jenny, feel free to jump in. Do you think that many independent abortion clinics will be forced to close as a result of funding cuts during the pandemic or state legislation around that? And what can we do right now to support independent clinics? And then maybe you could just talk a little bit about, in general, the kind of role that independent abortion clinics play in the whole landscape of abortion care.
Yeah, thank you. And I just wanted to add one thing to what Jenny just spoke to really eloquently in terms of the strategy of our side of those of us fighting for reproductive freedom and autonomy. I think it's important also to recognize that the efforts of the anti-choice movement to, you know, try to enact laws are just blatantly unconstitutional and will like never actually be enacted, such as like a ban that bans abortion at 6 weeks or something like that. That is like very much, I think, an intentional effort to the cultural needle, so that like when a 20 ban seems reasonable in comparison. So I just wanted to say that, like, in the same way that we must frame our struggle as one that is all or nothing, you know, not just legal, but paid for by the government, abortion on demand without apology. I think we need to recognize that the antis are like laws like that force public, and I think that it's just we need to go as hard as possible in the other direction. So I sit on the board of directors of an organization called the Abortion Care Network, which is a group that represents and serves independent abortion clinics all over the country. And
you're cutting out a little bit for me, Amelia. Are you cutting out for anybody else? Yeah. Okay. Maybe, Amelia, we're just going to come back to you. I'm going to take another question. Yeah, we're having trouble hearing you. So we're going to just come back to you in a minute or two. So I'm just going to mute you for now. Let me pose a question to Marie, and then we'll get back to Amelia. Marie, I'd love to hear about what it's been like for you reporting on reproductive health care and abortion access during this pandemic. And I'd love to hear about how you became a beat reporter for self-managed abortion at Vice, how that came about, and how your beat and your reporting has changed since the pandemic started.
Sure. Thank you so much. And yeah, I really appreciate you putting this together. So yeah, reporting on self-managed abortion has always been sort of difficult. By nature, self-managed abortion is something that happens very privately. And because of some of the criminalization that surrounds it, which I can talk more about later, people aren't, you know, talking about this in public forums with their names attached to it. So my beat has always required me to go on forums and into online spaces where people are sharing knowledge about how to give themselves abortions at home without any medical supervision. I kind of came to this beat by accident. I guess it wasn't a total accident. I think for many reporters, your beat is something that you come to pretty organically. So I had been covering reproductive rights for Vice for a while, and sort of my stories just led me to self-managed abortion, because the more I reported, the more you know, the advocates and experts I spoke to were talking about medication abortion and, you know, the obstacles to getting abortions at clinics and the options that people are then left with. And also in the last year and a half, almost 2 years maybe, Aid Access has come onto the scene, which is an online site where people can consult with a licensed physician, Dr. Rebecca Gompertz, and buy abortion pills through her site with her oversight to give themselves abortions. So a lot of my reporting gravitated to self-managed abortion because everything was leading me to believe that self-managed abortion and medication abortion was going to be sort of a new frontier of access in the fight for abortion rights and access. I guess to answer your question about what's different during the pandemic, I mean, I think, like you mentioned in your opening remarks, that the states that are trying to use the pandemic as an excuse to ban abortion, they've really created an atmosphere of chaos and uncertainty, and people who are seeking abortions in those states aren't sure of what their rights are on and their rights and access could change on any given day. So as a reporter, it's just been a little difficult keeping up with all of those changes, and, you know, looking at what people are saying online about their experience trying to get abortions at different clinics, and then trying to figure out how that matches up to mandates and restrictions that are being passed down from governors and state officials.
Great, thanks. It looks like we have Amelia back now. So let's get back to Amelia to talk about independent abortion clinics.
Is it still bad? I don't, if I'm still cutting out, I can try to turn off the video.
I can hear you, yeah, pretty well now, but yeah, if you start getting choppy, maybe try turning off the video and that could help.
Okay. So I am on the board of directors of the Abortion Care Network, which is an organization that serves independent clinics all over the country. Although many people think immediately of Planned Parenthood when they think about abortion care, independent clinics actually provide 60% of abortions and the vast majority of care after the first trimester. These providers are also the ones that are most often holding down the most politically and culturally hostile places in the country. I believe that of the 6 states with only one provider remaining, 5 of them are independent clinics. And this is an important distinction in this moment, especially because the independent clinics in this country are being hit by COVID really in the same way that independent book publishers or record stores or restaurants are being hit by the pandemic. And they just don't have the centralized communications apparatus or institutional support of a larger organization like Planned Parenthood. There has in fact never been, until last week, actually, there has never been a centralized fundraising effort to benefit independent clinics. We are currently doing that for the very first time because these clinics are for the first time experiencing this just urgent, critical, shared, concurrent need. And that need is coming from, like, again, a lot of the same reasons, not just because of governors like Greg Abbott in Texas declaring that abortion is not an essential service, but simply just the same reasons that other businesses are having to change the way that they provide services. So this means that implementing social distancing in clinics means less staff at once. It means seeing less patients at once. It means that clinics are potentially expanding their scope of services to include telemedicine, or maybe they're starting a trans healthcare program so that if their state governor does crack down on abortion specifically, they'll have an alternate stream of revenue. There are a lot of additional physician travel costs as staff, especially the folks actually performing abortions, are needed to shuffle around from clinic to clinic, from state to state. There are increased travel costs, and there are, you know, increased just sort of like administrative costs, along with trying to shift the way that clinics are providing care. So after COVID struck, the Abortion Care Network, which again is like the closest thing that these indies have to any kind of centralized organizational structure, the ACN did a study, a financial survey of their clinics, and they also looked at what's happening, or what has happened in Seattle, which is where I live, incidentally, and as we know is where COVID first landed in the United States. And they looked at how COVID has impacted the ability of indies in our area to provide services, and how it's impacted their financial bottom line. And they aggregated that Seattle-specific data with what they had heard from upwards of 100 of their member clinics all over the country. And what they found is catastrophic. What they found is that 92% of independent abortion clinics in this country will face closure in about the next 6 weeks. They will face closure, or their ability to provide abortion services will be in jeopardy, unless there is an emergency relief fund of about $5 million to essentially float these clinics through this crisis. So it's really an unparalleled, I mean, it's interesting because, you know, I think the movement the last few years since Trump was elected has been like a lot of war rooms that are trying to figure out how access will be decimated at the state level, and by potential Supreme Court decisions coming down the pike, such as the decision in Louisiana that we're seeing every day. And you know, there are a lot of different ways that can go down, that state level access can be decimated. But COVID has come out of nowhere and has really just kind of put everybody on the ropes at once. And it's not something that anyone anticipated or has the financial resources to buffer, especially because folks have been investing so much in contingency plans surrounding the Supreme Court verdict and other state level bans. So what I can say is, it's clear to me that independent abortion providers are the backbone of access in this country. I think that the world is the country is unimaginable without independent abortion providers. There will be no meaningful access to abortion, especially when we're talking about second trimester abortion after about 13 weeks. If these clinics close, that kind of abortion will be something that is only accessible to people of means, and that is not access. That is not reproductive freedom. That is not something that we can accept. And of course, it's a really, really, really hard time to raise money because more people are strapped than ever before, with so many of us losing income. But this is all to say there is this centralized fundraising effort happening for the first time. You know, many of these clinics have been open since Roe, but there is for the first time this emergency relief fund coming together through the Abortion Care Network. You can visit keepourclinics.org and you can donate there. You can share that link. And also just, I would say, to make yourself aware of the independent clinics in your area. The Abortion Care Network has a state-by-state list on their site, and independent clinics, like the providers that work at these places, are incredible. They would love to hear from you. They would love for you to express interest in supporting their work, and the answer in terms of how to do that will look different in every state. Because these are independent clinics that have very different locally specific concerns and needs. But yeah, I would just encourage folks to to visit the Abortion Care Network's website, abortioncarenetwork.org, and to visit keepourclinics.org if you are able to donate. Yeah, it's really scary. It's really, really, really scary, and it's so hard to break through in any kind of communications way about an urgent fundraising need right now because there are so many at once. But I truly can't hammer home enough that, like, if indies go away, there is no meaningful access to abortion care in the United States.
Just a follow-up question for you, Amelia, from the chat. Can you talk a little bit about Shout Your Abortion? How did Shout Your Abortion get started? So maybe you can talk a little bit about the message and what are you guys up to now?
I had an abortion at Planned Parenthood about 8 blocks away from where I live in Seattle in 2014. And in 2015 was when there were a bunch of propaganda videos circulating, which made it seem as though Planned Parenthood was selling fetal tissue on the black market. I was really, really angry, and I was really horrified that the sort of efforts to defend Planned Parenthood coming from the left seemed to be on the grounds that they did many other things besides abortion, that they provided birth control and STI screenings. And I felt as though that line of defense was just very much reifying abortion stigma and was also just sort of implicitly suggesting that the antis that were creating this propaganda like had a point, you know, that abortion really is this like horror film chop shop, you know, fantasy. And those videos were incredibly damaging, even though they are just like batshit crazy. And I felt very strongly that they were able to be damaging in spite of being ludicrous, because nobody was just out there telling the truth and talking about what abortion is. And I had sort of been experiencing, like, I think in my own circle, just like percolating cultural consciousness that even women like me, even like very progressive, feminist, radical, pro-abortion women, were not necessarily out there talking about our own abortion experiences, even with each other, even if we had volunteered at, you know, Planned Parenthood together or marched at pro-choice rallies together. And so the day that the House of Representatives voted to defund Planned Parenthood because of those videos in 2015, I wrote a status update on Facebook saying that I had had an abortion at Planned Parenthood, that I was not sorry or ashamed, and that I was just incredibly grateful for having had access to that care, and that I was speaking about this publicly because I felt that the anti-choice movement was relying on silence from pro-choice women who had had abortions. That status update then went really viral. In part, my dear friend Lindy West, who now has a Times column and a successful book and 2 books and television show on Hulu called Shrill, in which A.D. Bryant has an abortion in the pilot episode. Lindy put this on Twitter, and this hashtag Shout Your Abortion went viral over the next few days as hundreds of thousands of people started sharing their own abortion experiences online, often for the first time in their lives. And it pretty much immediately was not just an online movement. People all over the country were having events and making art and you know, doing graffiti and making clothing and having abortion speakouts. You know, all of these things are, I think, tactics which, as Jenny can speak to, this is a continuation of work that people have been doing for a very long time, and of ways that people have been talking about their abortions for a very long time. But I had never, and I think most people had never seen this sort of just open talking about abortion everywhere on the internet, in the coffee shop, at the art gallery, like really just hit the mainstream media in this way. I mean, it was on the front page of the New York Times, many, many other places. And that to me was just an indication that this was a conversation that people were desperate for and were ready to carry forward in their own communities in a myriad of ways. So that is essentially what Shout Your Abortion does. We create places in art and media and help co-produce and coordinate events all over the country where people are talking about abortion on their own terms. As Anne mentioned, we have a book, which is also called Shout Your Abortion. It is full of all sorts of, art and actions and things that we've done, postering, buttons. There are templates for making all sorts of pro-abortion materials. There are testimonies from people all over the country, ranging in age from 17 to 85. There are sex workers and politicians and religious folks and just every kind of story that you can imagine. And this book is now in the waiting and recovery rooms of almost 300 clinics all over the country. We hear incredible feedback from clinicians. And as far as what we're up to now, we have an artist in residence program where we're spotlighting the work of people such as Viva Ruiz, who is a New York-based artist, activist, teacher, organizer, who started a movement called Thank God for Abortion. She does all sorts of conceptual work. She's made pop-up abortion churches, has had various kinds of installations, has built pride parade floats that are abortion positive to march in the New York City Pride Parade. We are currently working on children's books about abortion. We are working with an incredible sex worker in Philly named Jessa Jordan, who's doing a DIY film festival called Abortion Palooza that is now maybe going to be online. But so that is what we do now. We have also a website where you can go add your abortion experience in text or video, and people are using it every single day. So yeah, that's what we are up to.
Great, that's awesome, thank you. We've talked a little bit about self-managed abortion, but I think it'd be good to maybe just define what that is. So what exactly do we mean when we're talking about self-managed abortion? And also, how can activists support increased access to self-managed abortion and medication abortion? So maybe Marie, if you could just give us a brief overview of what self-managed abortion is that the same thing as the abortion pill? Like, what does the abortion pill actually mean? Maybe, yeah, just introduce us to this concept and then talk about what the obstacles are for increased access.
Sure. So something I've encountered in my reporting actually is that a lot of people don't know what you mean when you say self-managed abortion. So I think this is a really important question, just to demystify the term itself as well as what it involves in practice. So self-managed abortion is a form of medication abortion, which involves abortion pills. Usually it's a 2-pill regimen with mifepristone and followed up by the drug misoprostol. And what we mean by self-managed abortion is abortions that happen outside of a traditional medical context. So if you're doing medication abortion through a clinic, like say you go to Planned Parenthood and get the abortion pills there, most of the abortion itself will happen at home outside of immediate supervision. So in a sense, self-managed isn't a perfect term because even when people go to a clinic, a lot of the abortion is, in a sense, self-managed. They're passing the pregnancy at home, but they have the support of doctors and clinic staff at the clinics themselves. So self-managed abortion is with pills. Usually those pills are bought on the internet. So earlier I mentioned aid access. Aid access is one of the most, I don't know what the best word is here, but it's the most widely used. And from what I've heard from many people who've given themselves abortions using pills they bought from aid access, it's the source that they trust the most because it is the only site that has a physician who runs it and will consult with patients and write prescriptions herself. And that's Dr. Rebecca Gompertz. She's based in the Netherlands, and she runs her practice from there. So one of the biggest obstacles to self-managed abortion, and the reason why people go online to buy pills, is because of longstanding FDA restrictions on mifepristone. So 20 years ago, when mifepristone was approved, the FDA officials placed restrictions on the medication, saying that in order to take it, you had to go to a hospital or clinic, and a licensed physician had to dispense the pills to you there. So that means that the obstacles in place for people who are seeking medication abortion are many of the same obstacles people face just getting to a clinic. That has to do with distance to the nearest clinic, cost. A medication abortion can be about as expensive as an aspiration abortion in a clinic, versus at Aid Access, the medication costs $90, and Dr. Gompertz will waive the cost, or just take a small donation for the pills. So it's the cheapest option out there. And it's also important to say that doing an abortion with this method is safe and effective. There's plenty of science and research that shows that self-administering mifepristone and misoprostol at home by yourself is just as safe as if you went and got the pills at a clinic. And that's also the reason why many physicians and advocates, and even the former FDA commissioner who approved mifepristone, has called to lift these restrictions, because they make it harder for people to access abortion, and especially early abortion, because the abortion pill is only approved for use up to 10 weeks in the United States. There are a lot of different legalities surrounding self-managed abortion, so that is the only thing that makes it unsafe, is the actual ways that lawmakers and the FDA have attempted to criminalize it. So some states have explicit laws that say doing your own abortion is illegal, but some have what are called fetal harm laws that prosecutors have tried to use to arrest and prosecute people who they suspect of self-managing an abortion. So I know that's a lot, but those are sort of the basics to understanding self-managed abortion, what it involves, and some of the risks, which, like I said, are primarily legal ones. Alternative.
And it seems, yeah, it sounds like, Jenny, do you want to jump in and talk a bit about self-managed abortion, and maybe especially address if there's anything that activists should be aware of or can do to support, more access to the abortion pill?
Yeah, well, there are a couple of things. There has been an effort to try to get the REMS restrictions off of the pill, which would mean that any GP or GYN could prescribe it. You could get it at a retail pharmacy like any other drug. So that would be a big advance in terms of access for medication abortion. The ACLU has sued the FDA asking for that. But with the pandemic, recently 21 state attorney generals wrote to the FDA saying that for the period of the pandemic, these restrictions should be lifted so that people can get abortions more readily. And so that is really a big deal, to have all of these state attorney generals, including states you wouldn't expect like North Carolina, getting on board on getting rid of the REMS, at least for the period of the pandemic. So that's a big advance, I think. And the other thing is that there are gynecologists who are arguing that there really is not a reason for this to not be an over-the-counter drug. Now, my group, National Women's Liberation, has a lot of experience working on getting the morning after pill, which is after sex contraception, over the counter. And I think it's a very doable struggle. It took us 10 years to get the morning after pill over the counter. We had all kinds of attacks. Children were going to get this. People were going to use it as a rape drug. All kinds of really crazy things. But what it boiled down to is that the companies that wanted to sell the drug were on our side. So we created sort of an unholy alliance to get that through. So that is also a factor in the abortion pill. And I think that we have a good opportunity to, at least if we demand it over the counter, we might at least get the REMS off. But really what we need is for everybody to have access to this pill without restriction. And, ideally it would be free, since it's such an important part of determining our lives.
And we talked a bit about the criminalization of people trying to use the abortion pill. I wonder, Jenny, if you could just speak a little bit about kind of the criminalization, especially of poor women and women of color, and how it's being used to target, especially those women for trying to seek abortion care through medication abortion. And maybe a little bit about like the kind of the history of criminalizing and racializing people attempting to seek abortion care.
Yeah, I mean, it's no coincidence, I'm sure, that most of the people who have been prosecuted for self-managing their abortions, or possibly even just having a miscarriage and being accused of self-managing their abortions, have been women of color, although white women have also gotten hit with these laws. The main thing is that we have, in comparison to the 60s, when doctors did occasionally go to jail for giving abortions. They usually went for about 3 or 4 months. And women occasionally were jailed or had a court order that they had to marry their boyfriend or live with their parents. We now have such a massive carceral state in this country that people are looking at 10 years for having an abortion. So part of the problem is that in comparison to back when abortion was illegal, we didn't have this enormous carceral state. We didn't have this enormous effort to lock everybody up. So we're facing quite a different situation. Most of the times that people get caught for self-managing an abortion or having a miscarriage is they don't know what to do with the fetal remains, or they go to a hospital and say they took the pill. If you go to the hospital because you're having bleeding after the abortion or you feel that that's fine, but you don't actually have to say anything about what happened. You can say, I think I'm having a miscarriage, which is correct. It's medically correct. And they will treat you in exactly the same way, whether your miscarriage was caused by pills that you took or just random, because people have miscarriages a lot. So that's something for people to know if they're going to have a self-managed abortion. That the main ways that people get caught. So you need to make a plan if you're going to do it. If it's an early abortion, if it's fetal remains are not an issue, you're talking about something that's extremely small and basically is like a period. If it's getting into the later weeks, you might want to make a plan. So it's very important for people to understand this, and having knowledge makes it less scary. you're very unlikely to get caught under these laws unless you actually report it yourself in some way, or tell friends who tell friends whose husband is a cop or whatever. So just be aware that's, but nobody should be prosecuted for any of these things. This is not, pregnancy outcomes should not be a crime. I think that's one of the demands that we have to make. And, when we say free, safe, legal abortion, we mean pregnancy outcomes, no matter what they are, cannot be a crime.
So connected to that, the kind of increased access, how can we kind of fight for, Medicare for all and for health justice and all of these kind of interconnected issues? How do we make sure that our demands and our struggles for all of these different things are kind of speaking to each other, because they are all connected? Maybe Jenny, you want to start, and if anyone else, if Marie wants to jump in and just talk about the kind of interconnected demands between health justice, Medicare for all, and abortion access.
Sure, I can start. The easiest way to have a free, safe, legal abortion is to have a national healthcare system that covers it, which is what most other countries with national healthcare systems have. So, and the struggle to get a Medicare for all system in the United States, for example, the Bernie Sanders bill includes abortion and birth control and everything. So that's part of the struggle for healthcare, obviously. So we have spent 40 years trying to get rid of the Hyde Amendment, which is an amendment that is passed every time there's an appropriations bill that says that federal funds cannot go to abortion, which means that if you're on Medicaid, or if you get your health care through the Indian Health Service, or if you're in a federal prison, if you're in the Peace Corps, in the military, none of these places can you get your abortion paid for. But the easy way to get to, and the more inclusive way to end Hyde, is to just make sure that everyone has all the health care they need. And that can be done by a Medicare for all bill. I mean, I've spent a good portion of my political life fighting Hyde, and I think that the better way to go is to just demand full healthcare rights for everybody, no matter what, where it's not dependent on your insurance, it's not dependent on some little program where you have to sign up and then you get kicked off, and all of these things, which happens with Medicaid a lot. And now several states are trying to institute and have instituted work requirements for Medicaid. So now you're in danger of getting kicked off if you're doing work that is not recognized by the state as valuable, such as childcare or taking care of sick relatives or elderly parents. That kind of program that's means tested is just absolutely hits poor working class and people of color much worse. And what we need is a program that gives everybody the same care and free.
Anybody else want to jump in on that? Okay, let's move on. Let's see. I guess just a more general question about, why are we facing such a crisis getting access to abortion and to birth control, despite the years and years of organizing? Jenny's mentioned pushing for an end to the Hyde Amendment. What is it that you think is causing this kind of roadblock? These obstacles. Maybe you can speak to both the kind of legal landscape and also just to maybe public opinion and, how this has shifted over time. Marie, do you want to start us off?
just to sort of call back to something that Amelia was talking about earlier, I feel frustrated constantly that it seems that the reproductive justice side of this fight has often ceded a lot of ground to the opposition and has backed away from, abortion on demand without apology, to at times safe, legal, and rare, which even though we, think is a term that no one uses anymore, is still very much in use. And I think that is part of the trouble. I mean, in terms of the legislative side of this, I just think that the antis have been super organized in getting seats in state legislatures, where a lot of these bans that we've seen over the last few years have come from. And, the Trump administration has been able to appoint so many conservative judges to all levels of the court that are letting these laws go unchallenged, even when they're, in many cases, blatantly unconstitutional. So I think we're seeing it on every level, on the grassroots level, all the way up to the courts. And I think that what we're seeing right now is just the result of, not something that just happened when Trump took office, but years and years of chipping away at the legal foundation to abortion rights, which we know the law, as Jenny was saying earlier, Roe v. Wade in itself isn't enough to give people access to abortion. And so over time, it's really just been chipped away at, to the point where for so many people, it's nothing more than, a concept.
Jenny, do you want to go ahead?
Yeah, I think another important thing that we should think about that that is different now from when we actually won legal abortion in 1973 is that the birth rate has been going down. It was at a post-war high in the late 60s, and the power structure wasn't that worried about the birth rate. In fact, they were worried that the cities were overcrowded and the schools were being overwhelmed, and they were particularly worried about Black and brown reproduction rates. But the U.S. economy is predicated on extracting unpaid labor from parents and especially mothers, and conditions have gotten so bad that women are refusing to have kids, which means that our birth rate is now the lowest it has ever been in the history of the country. So this gives an extra oomph to the power structure worrying about abortion. And I think a lot of people think, well, abortion, it's two sides. One part of the public thinks that, has religious objection. Another part of the public is for it. And the government is kind of this neutral arbiter between these two sides. But if you look at both centrist and liberal and right-wing think tanks, you can see that they are very concerned about the birth rate, and their main concern is that they want a growing population so that the economy continues to grow, because capitalism requires constant growth. So we're at this point where this is sort of getting a little stated a little more nakedly. They complain that the the age ratio skews too old, and so we have, you know, Lieutenant Governor of Texas Daniel Patrick saying you should be willing to die if you're over 60 for the benefit of the economy. We need to open the economy back up and let COVID have its way with people over 60. At the same time, they're shutting down abortion clinics. So you can kind of see that this is the naked agenda here is, you know, kill grandma, force us to have kids, which, you know, in their minds would help profits, would help corporate profits because it would increase growth. You know, they only get dewy-eyed about the sanctity of life when it's future young workers that they're trying to get us to produce. When it's retired workers or people in nursing homes, they're just an unwarranted expense. So I think we're starting to see that, you know, that hypocrisy is not really hypocrisy. It's really an economic agenda that they have for us.
Yeah, and there was a really good related question via Crowdcast from Zainab, who asks about the United States legalizing abortion through the courts rather than in many other countries. Abortion has been legalized through parliament, like in the UK, or through referendums, like in the Republic of Ireland. So how does that shape the way that we talk about abortion, how it's framed in our demands? And what are the limitations because legalized abortion was passed through the courts via these other mechanisms?
That's a very good question. Partly it was passed by the courts because they were afraid that state after state would legalize it legislatively, which is what had happened in New York. And they wanted to have some control over the parameters. So that's one of the reasons that we were given this concession in the Supreme Court. I think in countries where the movement won the victory legislatively, it's in many ways more secure because they had more organizing. And I think after the court decision, the feminist movement turned to other things like the ERA as their main priority and did not continue to concentrate on abortion. Although it's true that cowardly hospitals refused entirely to provide abortions when it became legal around the country. And so that's why we have all these independent clinics that started right after Roe. Feminists got together and said, well, okay, we're gonna provide the abortions ourselves. And that's how we have this network of clinics that Amelia was talking about being in such dire straits now that are the backbone of our abortion provision. So I do think that there's an argument to be made that the court sort of short-circuited that movement and that effort to get it fully legalized. But we also have to remember the U.S. is so the federal and state system, it's so balkanized, it's such a mess that it makes it very difficult. And this is regarded as a state matter under law. Makes it very difficult to win some of these victories in a national context, in a national way.
Yeah.
Maria, did you want to add something?
Yeah. Just really quickly, I mean, going back to how we talk about abortion, I think it being legalized through the courts as a matter of privacy has made a lot of reproductive rights advocates talk about it in terms of privacy, that this is, quote, a decision a woman makes with her doctor, when in reality, we know that people's access to abortion shapes their whole lives and the lives of people around them and their communities. And, you know, whether we know it or not, we've all been touched by people's access or lack of access to abortion. And so I think that the way that abortion was legalized in the US sort of constrained the conversation that we could have about it.
Yeah, there was a really great related question on YouTube from somebody who asked about the language that we use to talk about reproductive health and abortion, and how the language and the debate has kind of been seized by the right wing, and kind of limited the kind of demands that we have around abortion. I wonder if anyone wants to talk a little bit about the language used. I know that there's a lot of, there's a lot of feelings around using the terms pro-choice and anti-choice. Like, is there a problem with using choice as kind of the framework for, kind of who has access to abortion, and what language can we use, rather than choice and privacy and these kind of very conservative words? How can we kind of expand the language that we're using, to kind of open this movement up, and kind of bring it away from those kind of conservative origins? Yeah.
If I could, I'll start, and then I want to kick it to Amelia, because I actually wrote an article that I interviewed her for. But at Vice, we actually developed a style guide for how we talk about abortion. I want to shout out my editor, Susan Rinkunis, who worked with me really closely on making sure that, we're using accurate, non-stigmatizing words in our reporting, and that we're not using the words that conservative lawmakers use when they talk about abortion. But yeah, I wrote an article that I'll drop in the chat about how the words we use to talk about abortion have shaped the way that we understand it. And yeah, I talked to Amelia for this story, so.
So I unfortunately haven't been able to hear Jenny this whole time. I just heard Jenny's very first opener. And so it's hard for me. I don't want to repeat anything that has been said. And Jenny is so brilliant in talking about this specific, just sort of like the discursive analysis of our own movement. And as I was reading Jenny's book, Without Apology, it was like shocking to me how, I think that we share many of the same thoughts about really like this idea that, we live in a world we live in a country where abortion access is already severely limited. And in many ways, it feels to me like we've gotten what we asked for, which is some abortions for some people that are talked about in an apologetic way, if they are talked about at all. We have encouraged people as a movement to feel as though they maybe get to have one abortion, and after that, they should figure it out or be ashamed. And I think that in part, like, I really love thinking about the way we talk about abortion and looking at, like, we have exactly what we've asked for, and that it's not enough, and that we have to do better in framing our demands as really an all or nothing proposition. As many abortions as a person needs at any point, for any reason, paid for by the government without apology, that they can talk about or not talk about however they choose. I think that, the privacy point that Marie made is really salient and interesting, and that, yeah, like the fact that Roe is enshrined in this privacy decision is, I think, totally pertinent. And I think that, like, in many ways, people are so desperate for privacy in our reproductive lives that we've sort of conflated that with secrecy, and it's not the same. Like, whether or not you have an abortion is it's only other people's business if you want it to be, but whether or not you can access abortion is everyone's business. And I think that we all need to get way more comfortable talking about abortion. not just cis women or people that can get pregnant. I think that in part, one of the reasons why this conversation, or like why our rights are, why the legislation of this issue is so out of step with public opinion and need. You know, we live in a country where over 70% of Americans support Roe, and where 1 in 4 people who can get pregnant has at least one abortion, and yet we're seeing access decimated. And like, how is that possible? I think that, you know, it's possible because we've never figured out a way to like strongly advocate for abortion, and instead we've sort of asked for choice. And meanwhile, the other side has just like totally, you know, they've wrecked shop in the other direction, where it's like anyone, in order to even enter the conversation, you are on their terms, you're like sort of acquiescing to this idea that like abortion is maybe murdery or something. I want to make sure that we are that we're bringing abortion funds into this conversation, and I don't know when the appropriate time to do that would be, especially since I couldn't hear Jenny talking. But you know, like no conversation about access would be complete without talking about abortion funds. So I'm not sure when, I'm not sure if abortion funds have been mentioned or when it would make sense to do that.
No, not really. Yeah, now's a great time.
Okay, so I don't work with an abortion fund, but I spoke to a woman named Camion Connor, who is with the Texas Equal Access Fund and is also on the board of the National Network of Abortion Funds. As folks probably know, Texas, on March 21st, Governor Greg Abbott issued an executive order suspending non-essential medical procedures, and then the Attorney General Ken Paxton clarified that this did include abortion, which just kicked off like an over a month-long, really complicated legal back and forth between the state of Texas and abortion providers and advocates such as Planned Parenthood Federation of America, Center for Reproductive Rights, and the Lawyering Project. And during this time, the legality of abortion in Texas was very, very unclear, both to patients and people needing abortions and to clinics themselves. It wasn't clear to clinics if they would be in compliance if they were prescribing medication abortion, for example. And during this time, Texas abortion funds played this really crucial role in acting as like a communications liaison between patients and clinics, and helping people get the care that they need, which is what abortion funds do all the time. But in this case in Texas, it was like, more just like uncertain and legally frenetic, and just so unclear on the ground. And I think it's the way that they stepped in is really like emblematic of doing work in a radical, creative, nimble, by any means necessary kind of way that really abortion funds are our guiding light in showing us how to provide access in that way. And they're able to do so in a way that like larger organizations simply are not. So some of the ways that they were doing that during this like 5 weeks or whatever was that they were actively calling. So there were antis outside that were attempting to like catch clinics doing abortions, and patients were really unclear about which clinics were still providing. Appointments would be canceled one day, and then patients would have to be shuffled to a different clinic the next, sometimes across state lines. And during this time, abortion funds were able to sort of like create a back channel where they were talking to all these different clinics about like how many patients are you seeing a day? How late are you going? Do you have these supplies? How is your staff? Do you have a doctor that's able to travel? And like, sharing that information amongst clinics, and then tapping in with clinics and asking folks what they needed from funds. And then of course, providing people who needed abortions with funding and connection to travel and like all of that other practical support. So yeah, and one thing that Camion said that I just wanted to like read, she said, ultimately, abortion funds just always figure it out. We are nimble and adaptable in ways that larger orgs aren't. This sort of felt like HB2, but I think that it has been worse. And not, of course, not being able to show up and protest that we did at that time has been really frustrating. Abortion funds have always been the experts at connecting people having abortions to clinics. The pandemic and surrounding legal back and forth has made this a lot more difficult, but it is still exactly what we do. Funds are crucial because we try to center the folks that have abortions in a way that other orgs don't. A lot of our funds are made up of people who have had abortions, and because we live where we're working, we are experts on the landscape, the political and cultural dynamics, what it takes people to get care, and how to be creative. Abortion funds center the communities they serve and are staffed by people who are often volunteers who live in those communities and understand those complexities firsthand. This might mean working on the border like Frontera Fund and the West Fund in McAllen, and that is such nuanced work that it just must be done with firsthand knowledge. So there are 70 abortion funds in the United States. As Camion said, most are volunteer-led and volunteer-run. And if you go to the National Network of Abortion Funds website, there's a map of the United States. You can click on your state and find the funds in your state and a short description of what they do. And you can find a way to volunteer that might not, it might not be just donating money. Maybe you can help people with, maybe you have a car or a spare bedroom. You know, these are organizations that have been doing mutual aid forever and ever and ever, because as we know, the Hyde Amendment has made it so that abortion access is racist and classist, and that we've never actually lived in a country where everyone has access to abortion, and abortion funds have been filling that gap since the Hyde Amendment, really. So I just wanted to like shout them out. Also because of COVID, you know, their annual fundraiser is a bowl-a-thon thing that has like, I think taken in like a third or less of the funding that they usually get in the time of COVID. So if you check out the National Network of Abortion Funds website and donate if you are able, that is great to do.
Great, thank you. And we can put a link to that in the chat as well. Jenny, did you want to respond to the question about language and the kind of the limiting use of language that we're currently, you know, kind of being forced to use from a bygone era, and maybe like how we can, you know, work to destigmatize abortion and to increase our demands through changing our language?
Yeah, so what Marie said about privacy is absolutely right. You know, the women's liberation movement initially got rid of the stigma of abortion, or lessened it by speaking out about their illegal abortions, making what was private public by talking to each other. That was how they realized that it was a political issue, not some personal thing that they had just had to go through because they were irresponsible or stupid or whatever. They realized that, oh, this is a way that the ruling class is trying to make you know, trying to make us have control over our lives. The term choice came in the early 70s, and it was a way of backing away from the term abortion. One of the founders of the movement called it an emetic sort of shift. She really hated it, Lucinda Sisler. She, you know, and it was never a term used by the original women's liberation movement. I think using the word abortion, saying it, we cannot defend this right unless we can say the word abortion, is extremely important, and we should keep saying it as much as possible. And I think Shout Your Abortion has been the leading edge for making that happen. And you can already see the results. People, even in the nonprofit world, are saying the word more than they did, much more than they did.
Okay, we've got a lot of great questions. I want to just ask one question that we got from YouTube, and Jenny, maybe you can start. It's a question about late-term abortions. How can left feminists, kind of mount a more full-throated defense of late-term abortions? What is kind of our response, when kind of defending abortion rights, to defend abortion rights for everybody, no matter what point they're at in gestation?
Yeah, I mean, one thing to point out to people who are worried about late-term abortions is that all of these regulations and waiting periods and having to drive 600 miles to get an abortion are the reason that most people have abortions later than they wanted to have them. But truly late-term abortions are usually because there's a health problem. If you had free, full access to abortion at any time in your pregnancy, you could make the decision when you wanted to and make it earlier. So mostly it's a red herring thrown up by the right to try to make it seem like people are deciding late because they're, I don't know, bird-brained or whatever. But in fact, people get abortions as soon as they can. And when you survey people who've gotten abortions, when people get them later, it's because they had difficulty accessing the money or all of this stuff. And all of these regulations are designed to push you later and later in the hopes that it will push you over the line to where it's actually illegal to get your abortion. So that's, I think, the game that they're playing with the quote unquote late-term abortions.
Any other responses? Okay, I think we're going to wrap up in a few minutes, but I would love to end with a, maybe if all three of you can just respond to the question of, are there any hopeful signs that you can see as a result of this pandemic? Are people organizing in ways that you haven't seen before? If you don't have anything hopeful to say, that's fine too. If you want to put in a couple last minute plugs, please do. But let's start with Jenny, and then we'll go to Marie and then Amelia, and we can end on this question.
Yeah, well, as I mentioned before, I think it's very hopeful that we had 21 state attorney generals saying that the REMS should be taken off for the pandemic, which really indicates that the REMS are unnecessary at all times. So those are the regulations that the FDA has that make it so hard to get abortion pills. We also saw progress in the UK and Northern Ireland making pill abortions available to everybody very easily as a result of the pandemic. And then the other thing that we can see is that anti-abortion activists are very concerned that this pandemic is going to increase the options for telemedicine abortions, increase the pressure to make pill abortions more available, and they explicitly wrote the FDA demanding that they not do this. And right now there's a multi-state study of abortion pills, which you can read about and sign up for if you're interested at teleabortion.org. I'll put it in the chat too. So that study is aimed at looking at if people can safely use the pills. And that's the kind of study that would open up, if we had good studies, it would open up the possibility of making pill abortions available, much more readily available, getting rid of the REMS, and possibly even putting it over the counter. So I think those are some bright lights in what's otherwise a really dark, difficult time.
Definitely, I just want to echo everything Jenny said. Those are the same bright spots that I've been seeing in my reporting, as well as just more of a normalization of self-managed abortion, because people are using telemedicine in so many other parts of their lives and to take care of so many other medical needs. giving yourself an abortion at home doesn't seem so crazy to people who might have not considered it before. And that's what I've been hearing from a lot of the folks at Plan C. Plan C is a site that ranks abortion pill sellers online. And by ranks, I just mean they give you an idea of who has the most trustworthy pills, if there's physician oversight, shipping times. They give you all that information on a report card. But yeah, I think that that's the bright spot for self-managed abortion, is that it can still be highly stigmatized. A lot of people, as I said, don't understand what self-managed abortion is or how it's practiced, and still imagine coat hangers and other crude objects and methods. And the symbol for self-managed abortion is a pill. And I think a lot of people are realizing that they might even prefer to manage their own abortions and not go to a clinic. And so I think that a lot of people are realizing that even though in so many ways their choices have been even more limited during the pandemic, that there's this other choice they might not have even realized was there before.
Yeah, this is again really hard because I didn't hear anything that Jenny said, and I don't want to repeat everything. But yes, one of the things that I think is a bright spot is, being forced to talk about self-managed abortion, which is something that we should talk about anyway, because it's a viable option that even folks who I think have access to a clinic should be able to choose. That they should know that we should be talking about the fact that there are many ways to have safe abortions. And I think that even just talking about things within the legal framework always, we're never going to stop having abortions, whether abortions are legal or not. And so even like talking about safe and legal abortion, like I care less and less about legality. Obviously, I care about legality because I care about who is criminalized when abortion isn't legal. But, we are having abortions legal or not. And I think that the COVID crisis and the Trump administration in general has started to decimate access in a way where people are just talking about self-managed abortion in a way that, like Marie said, it's just no longer the coat hangers or disastrous, traumatic situation that it was in our foremothers' generation. We don't have to die in alleys. We don't have to have unsafe abortions in hotel rooms. In the first trimester, it gets, I think, dicier after 13 weeks or so. That's when we'll really start to see the ramifications of who this administration has decided can access reproductive freedom. I think that the other thing is that I bet Jenny said, but I think that before the Trump administration, a lot of comfortable white women just thought that anyone could have abortions that wanted to, and that that access was not in jeopardy, and also just really conflating the idea of Roe versus Wade means that everyone can have abortions who needs to, and obviously it's been illuminated since then that many people in this country have already been forced to carry out pregnancies and have children that they did not want to have, could not afford to have, because they did not have access to abortion, largely because of the Hyde Amendment. And so I guess just having that perspective that we need to do way better, and that this system that's crumbling has never been a system that served everyone to begin with. And so we need to aim higher and, really just talk about liberation and not just choice and abortion as like a commodity that can be purchased if you are lucky enough to have the income.
Bravo.
Yep, absolutely. That is a great message to go out on. We clearly do not have equal access to abortion right now. There's a lot of work to be done to make sure that abortion access is free, that it's equal. So thank you all for coming tonight. Thank you so much to Jenny, to Marie, to Amelia. You are all incredible. Please buy Amelia's book, Shout Your Abortion. Please buy Jenny's books, Birth Strike and Without Apology. And please get involved in activism. You know, we're not going to get abortion on demand unless we organize for it and fight for it. So you can join NYC for Abortion Rights. You can join DSA. You can join National Women's Liberation, and there's so many other groups out there. So please get involved. Let's make these demands together. Thank you so much, everybody. Have a good night.
Thank you.